what happens in public relations, and what is it that we can be able to learn from this particular module. So by the end of the module, we will be able now to understand, or by the end of this particular lecture, we will be able to understand what is public relations. We will also be able to explain what is the role of public relations in healthcare. And finally, we will also be able to describe various tools and techniques that are used in relations in healthcare. So I invite you to be able to follow through and be able to gain one or two ideas in regards to the introduction bit. Of course, we'll begin by understanding the meaning of the word public relations, and we simply define a strategic communication process that healthcare organizations build and build positive relations with their stakeholders. So the key understanding that you need to get here is that what you're calling public relations is to be able to communicate. With many others, public relations is about ensuring also the image of an healthcare organization is positive. Those that are the stakeholders within the healthcare system that has a good reputation. So over and over again, we will need regular communication to be able to ensure that we are right with the citizens, we are right with the government, and anything that comes up that is on the negative aspect of any organization, healthcare organization, then we need to come out as those responsible for public relations in the organization and be able to disseminate at least some positive information to ensure that everybody does not see us in the light that maybe some negative rumors before our organization. For example, in an hospital setup, we could be having a report on the death of infants. And whoever would be reporting would be saying in this particular hospital X, we have so many deaths. In every week, we are recording a number of deaths. Maybe they would be doing some investigative journalism, and they would want to expose some negative issues within the hospital, some rot within the hospital. Maybe we have laxity of staff. I see a news report where it was being reported that a woman delivered on the floor. So the hospital needs to come out and defend themselves. Why did that happen? They need to be able to explain that to the public. And also when you're doing PR activities, especially on maintaining a positive relationship, sometimes if this information has already been disseminated maybe to an entire country, the best thing we can be able to do is to own up the mistake, apologize, and promise a better way of doing things. Now, when we talk about stakeholders, simply the general definition of stakeholders are people that are interested in a certain organization. And when we look at the perspective of health organizations, we could be having various stakeholders. Various stakeholders for healthcare organization would be, for example, patients, we would be caregivers, the doctors, employers, it could be insurance companies, it could also be pharmaceutical firms, nurses within the facilities, unions, employee unions. These unions are basically meant to fight for the rights of the staff and nurses within these facilities. We also have employees that are working in the healthcare organizations. We also have a very key stakeholder that we refer to as the government, and so communities around the healthcare organization. So stakeholders is quite an extensive discussion that we could even discuss in lesson to be able to understand more about it. So now we ask ourselves a very important question: why is public relation matters very, very important in the healthcare system? Can the healthcare system, can we stay without having public relations? Can we be able to stay? That's a question that we need to ask ourselves. So the question is, the issue is that without that, we cannot be able to succeed within the organization without public relations. So number one, we have just said about the dissemination of information and create a positive image. So number one, through this we can be able to build trust with patients, families, communities around where the healthcare organization is located. So whatever that you disseminate, it means that the patients, the families, and the communities at place will get to hear this information. Of course, in which method to use is not standard. They should have print media, have regular press releases, have television. So it depends the kind of community that you have and what particular individual that would be able to reach so many people, communicate anything that feel is of importance to the organization. So the other one is we would have hospitals that maybe having laxity. I have seen hospitals in where the medical personnel go on strike, put the and it would not be a good thing to be associated with healthcare organization. Public relations is key in terms of protect reputation and ensuring that we have a positive image of them. And finally, we would be able to enhance communication with the internal stakeholders. We will also be looking at this, expanding on the internal and external stakeholders. Now, we also are going to look at the roles of professionals in health. So, public relations professionals are, of course, professionals that have knowledge and understanding of how public relations is supposed to be carried out. So, what is their role in ensuring that the healthcare system is working, is moving forward? The healthcare system and of role number one is on the issue of crisis communication. Role number one is on the issue of this issue. Now, in crisis communication is all about handling and mitigating crises effectively. So this crisis could be in the form of what I've just mentioned, the employee strikes. Of course, that is going to put the healthcare environment in crisis. Of course, it could be contributed by lack of proper payment. We have crisis in terms of surge numbers within the healthcare facilities, and facilities become on the facility because of overwhelmed. So we need to communicate the public that whatever that is, it can be handled and it will be solved. The other role of these PR professionals is patient advocacy, and by that we need to be representing patient interests within the organization. About disseminating positive information to the community to ensure that they understand that healthcare exists. So we said level of symptoms.
I don't really get the sound for the phone side.
You don't really do it. Kindly type on the chat. I am also unable to hear you.
I don't know if other colleagues can get it.
This could be internet issue.
Yes.
Are you people able to hear me?
Good internet.
Because Mr. Lomita is also
Yes,
talking.
yes, Samuel, I'm getting you. I'm hearing you.
Oh, yeah. But Lomita is talking, but we cannot hear him. Even Jansuk is saying that we are not clear.
You now hear me?
Yes, there I can hear you.
Yeah, when
Yes.
Samuel when he talks,
Okay, I
you're
think,
okay. But when Mr. Erastus is talking, the voice is off and
Yes.
on, off and on.
Okay. During the healthcare organizations have a positive reputation. They are well undertaking their activities. Any negative reputation, then it is the role of the PR professionals to come out and be able to defend the organization, apologize where possible, and also be able to make corrections on whatever they feel that is inadequate. So we talked about also them ensuring patients advocacy. So every patient's interest within the organization, they're the one to represent. If, for example, we could have patients having certain kinds of complaints, maybe slow services, lack of very committed staff, then the PR professionals will come in handy and advocate for better of anything that the patients have been able to complain. And also, they will also promote healthcare initiatives. We could be having new treatments within the healthcare organizations. We could have new services. For example,
just mute yourself. Just
yes,
mute yourself.
yes.
Okay, yes, muted. It's okay.
So we could have an healthcare organization that has introduced a new technology within the system, MRI machines, CT scan machines. And once they have introduced this technology, then they can make the public know that now we have new services, cancer treating machines, and so on and so forth. And also, finally, they will ensure ethics and compliance, ensuring ethical and legal PR practices. Now, what we call ethics is all about the good things that healthcare organizations need to do. And they also need to ensure that they are complying with various laws around matters health, matters disposing of waste, and so on and so forth. So anything that they will do negative is what we call unethical practices. So healthcare professionals or PR professionals would be key in pushing for the good things to happen within the healthcare organizations. And that will include good in terms of how we are offering our services, how we are dealing with different clients within the organization, and so on and so forth. From there, we could so that is key for all of you to be able to note the different roles that these individuals play within the organization, and ensure that they also need to be supported for them to be able to play this role. The role of management comes in handy to support them in terms of disseminating information. Sometimes we may need resources, for example, to promote healthcare initiatives. We may need resources to let the information out of the organization. So it is not a one-sided affair that they just do it alone. They need everybody to come on board and support them, including the rest of the staff, including management, and ensure that will now ensure that these particular roles are well undertaken. So now we have to call the public relations players in healthcare to be able to take the public relation process. We need, number one, to be able to do research. For PR to be successful, research is key. And when you are doing research, then you are collecting data, and it's about stakeholders and healthcare issues. I just gave an example of stakeholders. Maybe you want to implement something, PR activities around patients. So what we have just called patients advocacy. Then we could allow them to participate in research. Maybe there is some information that we need about them that is key. We can be able to engage them. Of course, we have a number of methods we can use. We can use questionnaires. We can also get feedback from them based on the services, how they found services within the organization. Then after that research is collected, after data is collected, we now be able to, the second thing is develop strategies and objectives and key messages. Now, a strategy is what we call a high-level plan. So we have already collected data. Maybe it's patients that want to improve on something. So we need now to come up with a plan of how this particular information is going to assist us. We need an objective. And we also now need to craft the key messages. Remember, public relations is all about a positive message. So we have a lot we can be able to say. If it's an announcement, maybe we want to make on television, maybe on a vaccination drive that we want to undertake. What is the key information that we cannot afford to leave out? For example, the dates. on when the vaccination is going to take place, what kind of the vaccination is going to take place, how many days is the vaccination going to be taking place. That's now what we call planning. Yeah. So now, once you have done your key messages, the reason why we are also doing the key message is because when we go to these print, television, radio, whatever mode of communication, we might be, or it's a must, we incur some cost. So everybody would be looking for something that is not very long, that's going also to cost the organization a lot of money, because it's not the only drive that we do. We have so many other things that we have to disseminate and announce to the stakeholders and to the public. So after you have drafted a key message, you have very nice strategies. You can now implement, execute PR campaigns using various tactics. So we have a number of tactics to execute campaigns. We do door to door. I see sometimes for vaccination of children, whoever that are doing it, we just walk every door, knock and check whether there is a young baby of a particular age. Then they can be able to vaccinate and serve them. So the activities of how to execute the PR campaign is something we need to sit down and think about. What tactics are we employing? We could be in need of moving to far places of South Sudan, where places are deemed to be very, very far. So how do we get there to ensure that this PR campaign, everybody has gotten the information? So we need to have a clear implementation plan. And also, when we are planning in the second one, of course, planning also will involve resources, financial resources when need be, to be able to ensure that the campaign is effective. And finally, in the PR process, we do measuring. We measure the impact of the PR efforts. Now, evaluation is simply going back and looking at what we have done since we began to collect research and see whether if it is a campaign we were running, a vaccination campaign, for example, we can be able to see whether it is effective. So that means we will go back to our stakeholders, the community, those people are serving, we can get feedback from them, get to know also areas that we can improve. As healthcare organizations, we should not shy away from also asking on areas of improvement. It is part of evaluation. And the key purpose of doing the last step of evaluation is to be able to improve on our next PR campaign. Any shortcomings that we faced, maybe we had some transport challenges, we had some financial challenges. The key purpose of evaluation is now to ensure that when we move to the campaign, then we can be able to improve and become better in terms of PR campaign next event. Now we have people that we are calling stakeholders in the healthcare public relations. I had already yes, Ronald. Okay. Mr. Samuel, am I still clear?
Yes.
Yes, Ronald.
Yeah.
Okay. Okay.
No, sorry. The point actually, I was muting my mic, then accidentally I pointed on the hand.
Okay. Okay. That's okay.
Yeah.
Yeah. So that's well noted. So we have various stakeholders I had already listed quite a number of them, but this particular slide is now to be able to clarify on these stakeholders. And I already said there are people that are interested in the organization in one way or another. So here we are saying it's all about individuals and groups who can affect or be affected by an organization's purpose and objectives. So in the context of healthcare organizations, you know, they have a certain purpose that they need to meet. And that's why I listed about, so we will have the primary stakeholders, for example. Those would be employees, or those are staff within an healthcare organization. Those are very, very important stakeholders. If we are not treating our employees very well within the organization setup, definitely it's going to spill over to the customers that we serve, because that is the causes of strikes, that is the causes of unrest within the workplace, that is the cause of reluctancy or lateness to work, because the primary stakeholder who is an employee is not taken care of. Yeah, so once you understand these stakeholders, then you are able to know how you are going to deal with each one of them. What is the role of employees? What is your role as the one in charge of the healthcare organization? Yeah, as the management team within the healthcare organization. Then we have different consumers, investors, would have healthcare organizations. Of course, we have the public and private. If it's public, of course, the government has put in money for the organization to be able to be running. If it's private, we have investors there who are looking at the aspect of how much profit that they are going to make. Yeah, so we cannot be able to be reluctant. Suppliers, we have suppliers of medicine, suppliers of drugs within the healthcare facilities. The relationship between these guys is very key. For example, if you're not doing timely payment to these suppliers, they would withdraw their supplies. And what does that mean to the stakeholders who are the consumers of the medication? That they are not going to receive these particular drugs. So explaining all that is simply to say that everybody is important. Every stakeholder within an healthcare organization is key. We cannot afford to be able to ignore them. And so those are the primary stakeholders. We also have the secondary ones, industry brands, government, community. The government is, of course, interested in ensuring that these healthcare organizations are providing the correct services to the clients. If it's public healthcare organizations, of course, government is key when it comes to funding of these organizations. And then we have the community. Of course, these are the people that benefit from services that the healthcare organizations are offering. We have the media, very, very critical. Anytime that we want to make any public relation campaign, media comes in handy as a major stakeholder. And over again, we would also want to do what we call press releases, where we just send out some short note in regards to certain news. One thing about what I've seen in Kenya, especially for the big hospitals, when they do a major surgery, maybe it is a surgery that is to separate conjoined twins, then they are going to call a press conference, and maybe it's the first one to be done within a particular facility. Maybe guys have done a brain surgery, for example, and they want now to communicate the positive side that the surgery went on successful. These guys, because of the PR aspect, on the public relation aspect, they are going to call the media and make that announcement. And of course, the patient is also there. Maybe they can give a comment on how they went through the process, what they think about it. Yeah, so media we cannot ignore. And also We could also have non-governmental organizations. Remember, the key is supporting various policies within the healthcare organization. They could come in handy also in terms of giving grants to these healthcare organizations, and could also come in handy in relation to providing it could be vaccination campaigns, it could be campaigns against HIV and AIDS or HIV and AIDS sensitization. The governmental organizations are also very key. So as healthcare professionals, we need to understand these stakeholders and see how we can always positively engage all of them. All of them are very, very important for the success of the healthcare organization. So now we have stakeholders in healthcare public relations. We could have, so when we are doing stakeholder management, we are going to follow stakeholder models which emphasize on mediation between interests of various stakeholders. So stakeholder management is all about ensuring that there is always a conversation taking place with the community, with the government, with every other person that we have just mentioned. Yeah, so that's what simply we call stakeholder engagement. So understanding their power, agency, legitimacy about the organization's action. Sometimes as organizations, we just make decisions without consulting. So regular engagement will now tell us what our stakeholders think about a certain decision that we have made. And we have a model here we call the stakeholder salience model that is going to help us now identify stakeholder groups based on their attributes and importance. So like we have listed the primary and secondary. So the salience model will now help us understand from the community perspective, can we have people that we can refer to as very important? Maybe the community leaders there. Because for example, if we are to run any campaign with these guys, we will need first to have a connection with the leadership within that community, the village elders, the community mobilizers, and so on and so forth. For any campaign to be able to work, those stakeholders are very, very key. Now we have what we call stakeholders in healthcare. We could have internal stakeholders, external stakeholders. When we talk about the internal stakeholders, we are referring to the healthcare staff, employees, the management. So internal stakeholders are simply within the setup of an healthcare organization. And then we have the external stakeholders, where we are going to bring on board the patients, the family members, regulatory bodies. We could have also what we call the media community. We have mentioned all that. Now, when we are developing strategies that we had mentioned in the process, we need to tailor make these strategies. When we are talking about tailoring public relations strategies, we are simply talking about crafting a PR strategy that will suit a certain group of individuals. That is key. And the only way to do that tailoring is to address unique needs and concerns of different stakeholders. So if you are dealing with employees, for example, then your PR strategy should be geared towards ensuring that these guys are enjoying their work, they are comfortable in the healthcare organization, they are able to understand the goals and objectives of the organization, what you intend to do, what you intend to
frustrated for them. Physical activity and health is very important, and we shall see others that are important in this case of public health education. So the Alma Ata Declaration has principles like primary health care, we have the and the community participation. So basically, as we go into the community to our
Yes, people, because they know the groups, they understand the people within that particular community. If you look at politicians, that's how they operate. For them to be able to, of course, they may not know everyone, but to use that strategy of using a community mobilizer, it would be easy for them to gather people and address the issues. That is it. Now, we have something very important in regard to public relations on what we call reputation. Now, reputation is about simply the overall way that people are viewing as an organization. I'm going to give an example of the reputation of university in South Sudan and the world. You will be able to make a comment in regards to that. So we are saying for us to be able to develop reputation, then we will need to have a series of decisions and actions that are taken by the organization. And that could be, for example, actions in regards to creating awareness, disseminating information, whatever kind of information. I said sometimes we will find ourselves in a scenario where we have a negative reputation. We have a negative information that has moved out to the public. And I gave an example of rampant deaths within hospital facilities that we can be able maybe to control. I have a friend who is a nurse, and they tell me when it comes to issues of infant deaths within public hospitals within Kenya, the government will not really entertain such that in case a case happens, there is always a team sitting down to ask questions of the facility at that particular moment. So you are held accountable. So remember, in terms of reputation, something small or a single thing that happens, maybe on the negative aspect, would affect the reputation of the hospital, and that or any other health organization, and that would lead to a reduction in maybe the number of clients that people are serving in a day. You will go to places and find maybe private hospitals have a better reputation compared to public hospitals. In terms of cost, you will find that public hospitals are deemed to be cheaper than private hospitals. So it depends on how. So a private hospital would maybe be disseminating information to tell every citizen, we are not expensive. This will cost this amount. So they disseminate that information so that people can know. So, so reputation will also involve the overall assessment of organization by its stakeholders. So assessment would be reactions. So it represents, excuse me, what we are calling emotional reactions. I just mentioned about Restyle. You can give a reaction that is good, bad, weak, or strong of customers, investors, employees, and the public. So reputation is key. As we continue with this particular discussion, then it is something as organizations we will seek to strive. Some company directors were in a meeting, and one of the directors told the rest, the only thing that we need to make sure that we always is to be on the positive side, because a single thing that maybe a director has done that is bad will the organization. If all of us that are in this are running a company, and then a Rasta has maybe been found with a corruption scandal, it is the company that people see. even as they see you as an individual who was part of the scandal, the organization is also affected. And of course, now we will get these bad reactions, emotional reactions. Investors will pull away. I'm sure you have had engagements around NGOs and donors. They want some element of transparency. And if you are not transparent, if you are not able to prove how you spent the money, then definitely some of them or most of them will always pull out from that engagement because they feel that it has not been well undertaken. So mostly they will demand for high levels of accountability if it is funding that they are providing to a certain healthcare organization. So reputation is key. That is something that we need to remember. Now, PR or public relations is not something that has just begun yesterday. We have an history. There is a place that we are coming from. So we are saying public relations have existed informally and they played a crucial role in capturing public attention. You can also see that in the early 1900s, we now formalized what we now today call public relations with the development of advertisement as a structural concept. If companies are not advertising their businesses today, most likely what happens is that numbers, maybe their client numbers would go down. So that's why you even look at the big companies that you know within your country. They will always continue to do advertisement. That is part of creating awareness. So the issue of creating awareness and the issue of public relations began in the 1900s. So it's not something that began the other day. And we have now the founding father of public relations, a person we call Edward Bernays. And he influenced the Uncle Freud's theory and introducing concepts like focus groups. When we are doing focus groups, for example, we want to generate ideas through groups. So we can be able to put individuals and guys together and be able to come up with ideas. It could be campaign, healthcare organization campaign ideas. It is easier to develop them through these groups. So we also look at public relations in the 1980s. In those years, we had restructuring trend where activities within organization were evaluated based on their contribution. So communication activities back then, we could only be able to evaluate based on if we have adopted a particular communication strategy, how has it benefited the organization, or it is resources that we lost. And then also we had the aspect of communication professionals consolidated in PR departments within established procedures. So organizations back then began now to have public relations department. So that means it is a department that is fully entrusted with matters, communication, matters of ensuring the relationship of the organization is top notch, matters of communicating any affairs within the organization, and so on and so forth. And then finally is PR are recognized as function benefiting the entire organization. So the public relation function is key, and the organization is bound to benefit. But when we keep quiet, we are not disseminating any information, then once in a while we are going to find ourselves in trouble. And you know, we have competitors. Healthcare organizations have competitors. Hospitals have competitors. And if somebody wants to tarnish your name, they will not care because it's about saying that hospital X is bad, so that people can go to hospital Y. So you have to be very keen also. If your name is in bad books, then you need to look for ways to ensure that you can be able to solve those issues. Then in the 90s, now we got to strategic positioning, where organizations were able to use PR to achieve competitive corporate identity. We have something we call a competitive advantage. That simply means you have an advantage over other maybe healthcare organizations. So in the 90s, now organizations began to strategically position themselves. When you have competitive corporate identity, then it simply means that you are able to stand out amongst other of organizations, similar organizations. Yeah. So also within those years, we could have communication professionals shape the organization brand in positioning it in the minds of stakeholders. Like we said about stakeholders, anything in regards to your organization has to be ringing in their mind. I'm sure today, if you have an item that you want to buy, there is that particular organization that pop comes into your mind. I want to buy a mobile phone, for example, and I am a Samsung person. Nothing else will come to my mind. And that's why I have just said companies, organizations will repeatedly do these public relation campaigns so that their information can always stick to our minds. If I want to buy a television, there is only one brand that I always believe is the best. If I am seeking some form of treatment, now why is India very famous in terms of matters treatment? Number one, they have placed themselves as having a very good corporate identity in matters treatment. So everybody who gets some of these diseases, by the time maybe they are leaving their country and going to India, they have hope and they are going to come back. They are going to be healed. Because even as a country, these guys have placed themselves as very good in terms of healthcare. So every country has what they are known for. You are told, if you want treatment for this and this, then go to this country. If you want these and these services, if you want certain goods, very good, nice goods, maybe for your business, go to this particular country. Yeah. So and then finally, stakeholders will always be considered passively with top-down approach and limited understanding. Yeah. So top-down approach means we are looking at all stakeholders from the organization point of view. It's not them tell us what to do, but from the organization perspective, we are watching them and adopting an approach that we will keep them close to us and we will keep them coming back to the organization and getting to understand us and also receiving our service. Then we get to 2000s in regards to public relations. Then we began to do stakeholder engagements. New media allows stakeholders to participate in organizations' PR actively. I have seen a channel in Kenya, a television channel that is going to bring a program in regards to health capacity. A doctor there explaining how they do treatments of a particular disease. Of course, that is also PR. If we get an interview of matters dental or with a dentist, then maybe have, besides that being a news item, we would have people wanting to know, and where is your facility? And when you go to social media and you are watching some of these engagements, you will also see people asking for location, where are you, how much are the charges? Those are stakeholder engagements. And of course, we have some that our organizations are going to pay for. And then, of course, from us, we are thinking it's an interview, but it's an interview also combined with public relations to create awareness. Hey, this organization exists. And then also relationships with stakeholders becomes dialogues rather than one directional communication. So now, when you make this relationship with stakeholders a one direction communication, what is likely to happen happen? Most of them might pull out from your activities. But when you want to run a campaign and you sit these stakeholders down and tell them, this is what we plan to do, what do you think as our stakeholder? Then they give their views. Number one, they are going to feel part and parcel of the conversation. So what is likely to happen? They embrace it and move with it. So they become your key support number one. And also organizations involve stakeholders through social media, leading to easier reputation. Nowadays, social media has become a very key stakeholder. So you are able to go live on your Facebook page, advertise, or have awareness campaigns in regards to any particular matter through the healthcare organizations. Now, public relations nowadays is what you are doing for PR today. It has now become a very complex, technical, and precise activity to do. Now, when you go to big organizations, like I said, you will find that they have invested in an entire department. The salaries that are being paid there, they are quite huge because they realize the importance of public relations and get to know that we cannot do without. So different areas of PR require different talents. So we can now recruit the best team. And that's why you see organizations also poaching PR staff. If somebody is very good in communication, you could easily bring them into your organization, give them better pay. And technological changes, and they're also on the rise in new media drive. With now social media becoming a major place, companies are even moving away from televisions and going to social media pages to create awareness through social media influencers, people that are running pages that have millions of users. So that's where we are today in terms of PR. It is complex. We have now adopted it as a career. So we bring on board diverse talents, people that have knowledge in communication. And even what we are doing here now, by the end of the module, you will now be able to understand how you can go about it and also get to learn about technology. Like doing our meetings, we can do them through Google Meet, through Zoom, through our platforms to be able to awareness, run campaigns. I have seen organization that deals with matters HIV and AIDS. It's called in Kenya. It's called the National AIDS Control Council. They will always have very many virtual meetings. And somebody was paid. Somebody was telling me they pay guys to attend these meetings. Of course, they are funded to be running such kind of activities. So, as part of creating awareness, everybody could join from wherever they are, from whatever part of the world, and join in the conversations around HIV and AIDS, what we need to do, what we can be able to improve. All that is public relations. That to what tool and tactics that we can be able to use for public relations to be successful. We can use media relations. I talked about press releases. I mentioned press releases are just short statements that people send to media houses. It may be late at night. So you just do a press release. It's just a small note on some news item that you would want covered in the news. And then we can do media interviews. I've also mentioned that. Crisis management plans. I'm sure during the period for COVID, we had organizations participate in crisis management sessions, activities, to be able to know how to survive during that particular very difficult season. And then also social media, we engage patients and the community through platforms. Facebook, Twitter now has become X, Instagram. We can use those platforms. Around events, we can organize healthcare fairs, seminars, community outreach programs, And then we can also develop alliances. When we develop alliances, we could also call them strategic alliances. They are partnerships that we can develop. And healthcare organization can have a partnership with a media house that, hey, anytime we are running the campaign, we are going to have it live on television. Those are alliances. You form strategic partnerships. So you look at what does your healthcare organization do. It's a wide industry. You develop partnerships with NGOs, develop partnerships with hospitals, and so on and so forth. And also have what we call media and influencer relations. So we need to identify key healthcare media outlets and influencers. So we could have visions that are running health programs. I've seen them in different countries. So we have this program that the television brings a medical profession, maybe to come talk about cancer, come talk about diabetes, come talk about conditions. So you need to have this kind of partnerships, maybe be able to push certain campaigns. In Kenya, for example, I've seen hospitals run they call marathon. They are encouraging people to come out and run, but any money that is collected from kind of activity will maybe treatment of them who have that disease. So collaboration is important. Yes, we have this campaign here, but how will people know that the campaign is there? How will people know that the marathon is there? We need to have media outlets and these organizations working together. Influencers are what I've just called social media influencers. We have people that are running very big pages in terms of numbers. We can also use them. So key establishment of relationships with journalists, bloggers, healthcare experts. Yeah, if you want your organization to be featured in newspapers, you need to know these journalists. You need to know those that write articles around healthcare. You need to understand them, have a communication with them. So anytime that you feel that some information needs to go out, you just reach them. We also have bloggers. They have also become key people in terms of information dissemination. Then we pitch stories and provide valuable insights. So we can give our stories out. Like I was saying about the success of a certain operation in an hospital. We can sell those stories to communities so that they know that particular organization exists. Preparing spokespeople for interviews and media interactions. This is very key for every organization. Now, the media will always have segments where they need issues of cancer discussed. They need issues of diabetes discussed. They need issues about healthcare discussed. So we need to have to know the people that we are going to be sending to the interviews. And of course, that should be somebody who is very knowledgeable. And of course, viewers are given opportunities to ask questions. So we need to be having people that can be able to respond. Managing media inquiries through crisis. So we could have inquiries that are coming around. So we can manage them, respond to these inquiries. Sometimes we are in trouble. That's what we are calling crisis, and people are asking questions. So you cannot afford to ignore. You don't ignore anything communication, even if it's negative. You need to try and say something. Of course, to try and bring the positive aspect on it. And also leveraging media to enhance healthcare organization reputation. So we have repeatedly mentioned about that. Media is key in terms of ensuring reputation. Now, what is the role of social media in healthcare, in PR? Now, social media, like I said, has become key. I will not even belabor to spend a lot of time in this particular slide. We have various platforms: Facebook, Twitter, LinkedIn, Instagram, and then we can just share educational content. I have just seen a lady on social media just a few minutes ago, and I noted that through her page, she does short videos on matters health. So she is going to speak about a certain disease for a few minutes, just to mention maybe the symptoms and something like that. So organizations now are able to create this kind of content. Success stories, I've just mentioned that. If as an healthcare organization you have a successful surgery, a successful campaign that you have been able to run, a successful in terms of uh, information dissemination, like during the period for COVID. Anytime that we had COVID discussions, there are people that we were sure we are going to see them on TV because they are good at it. They know, they understand the disease. They can explain to the layman what is this that is being called COVID-19. So success stories are very key. You have to look for them and you have to make them happen. If a surgery has happened in an healthcare facility for the first time, that information for the organization to move to the next level, let's send that information out to social media pages, to televisions, to print media. The first of a kind, that's how they write the articles. The first of a kind surgery happened in this and this place. And also giving healthy tips. I've seen television programs running healthy tips in terms of nutritional advice. What should people eat when they are having this kind of a disease? Those tips you just give them through the media, people to be able to understand. When we are running different events in healthcare PR, we could do event planning. So we can decide on the type of events. Healthcare fairs. Fairs are just form of shows where healthcare organizations are going to come and display various things that they do. We can also organize seminars. We could also do fundraising events, event logistics, budgeting. For these events to be able to go on, definitely we have the issues of budgeting coming in hand. And also we need to have timelines when these events are going to be taking place. And now we go ahead, when you are planning these events, we also go ahead now and do promotional strategies for event attendance. Of course, it's very shameful to say that you have an event and then you wake up there on that fateful day and you realize, no, people have not turned up. It is just a mistake of how did we create awareness for the event. Event execution, we need to ensure a seamless and memorable experience for attendees. Yeah, so if we have running any campaign, we also need to have these people that have come to the event, when they are going home, they need to be, of course, speaking positive about the event, that it was okay, so on and so forth. Joseph? Okay. So we need to ensure seamless and memorable experiences for the attendees. So how do we do that? We can also see the kind of people that we are bringing on board. In terms of qualifications, professionalism, patience, the community, and so on and so forth. So we could also form partnerships. We could also form collaborative initiatives that are going to mutually benefit everyone. We could also be able to build and maintain relationships with healthcare influencers and organizations. and also leveraging on partnerships for advocacy, research, and community engagements. Now, we have something we call corporate social responsibility. This is simply what we call giving back to the society. And it is key for every healthcare organization to be able to do that. So it's simply a commitment of businesses to contribute to economic development while improving the quality of life for the workforce. So the community, the society at large, we can be able to encompass the triple bottom line. So people, social, and labor issues. So any place where an organization is existing, it is important for us now to be able to also do activities within the community that are also going to create awareness. Sometimes you will see organizations just sacrifice the whole day to carry out campaigns, awareness campaigns against various diseases. And they are not asking the community to pay any shilling. That's what we call corporate social responsibility. So we involve people, and we carry out activities within the community setup. We have what we call community relations. We are going to involve communication and engagements with locals, residents, in terms of healthcare operations or how healthcare operates. So these relations are key for the success of the organization. They are very, very important. So when corporations are becoming very influential, communities expect them to balance economic objectives with fair treatment of the community. So the community, the people within a community are very interesting people. They know that you are an healthcare organization and you exist in a particular place. So they expect you, of course, to be able to participate in what we are calling corporate social responsibility activities. So what you are going to do, anyone who maybe would have a comment, we want to wind up. Okay, so if there's, okay, Bedwell.
Sorry, I was talking when the mic is muted.
Okay, yeah, go ahead.
So basically